The last weeks of summer vacation are here, and before you know it, kids will be back in school. While you're shopping for school supplies, a visit to the pharmacy is also a good idea. Patient care pharmacist Chelsea Kwong is here with tips to help plan a healthy year. Good morning to you.
Hi, good morning, Corey.
So how can pharmacists help with back-to-school preparedness?
Yeah, so visiting your pharmacist before going back to school can help to make sure that you have all things health covered. For any kids that might need medication at school, such as inhalers or EpiPens, you'll want to check their home supply and their school supply to make sure that neither is expired and pick up a new one at the pharmacy if you need to. Some school boards may require written authorization in order to provide medications to students. And your pharmacist can help to make sure that you have all the necessary information, including things like extra labeled pill bottles with the dosage, directions for use, and storage information, so that teachers and caregivers can administer the medication safely to the child.
Very smart. Now, we've been hearing a lot about measles, and I think a lot of people are wondering about things like vaccines. What types of vaccines are recommended for a healthy school year?
Yeah, so your pharmacist can check vaccine records to make sure that your child is up to date before getting back into the classroom. In Alberta, the routine vaccination schedule for school-age children includes vaccines at age 4, grade 6, and grade 9. And of course, with measles outbreaks in many parts of the country, making sure that your child is fully protected against this dangerous illness is really important because it can spread really easily in public areas such as schools. So full protection for measles means getting 2 doses of vaccine on or after age 1, and it's usually done by public health even before a child enters kindergarten. Other vaccine preventable illnesses that you can talk with your pharmacist about include hepatitis, HPV, influenza, and COVID.
So very smart advice there. Are there key items parents should pick up at the pharmacy before going back to school?
Yeah, so back to school often means that schedules get a lot more hectic. So making sure to refill any regular prescription medications to avoid that last minute rush is really helpful. If you aren't able to get in with your family doctor for a refill on time, your pharmacist may be able to renew your prescription to ensure that you don't go without any of those medications. It's also a good idea to look through your medication cabinet and refill things like cough and cold medications or pain medications to help avoid a late night pharmacy run.
Okay, and summer may be meaning less contact with other kids, but heading back to school, you're with more kids, more people. How do we avoid back to school illnesses?
So the most important way to stay healthy is to practice good hand hygiene. So washing hands regularly with soap and water or using a hand sanitizer if necessary. Kids should also be taught to cover their nose or mouth when they're coughing or sneezing to prevent spreading germs to others. And head lice is another nuisance that's common in school-age children, but they can be prevented by avoiding head-to-head contact and avoiding sharing things like hats, toques, and hairbrushes. And pharmacists can assess for kind of all of these conditions and can advise if you need to see a doctor or if the symptoms can be treated safely at home.
Perfect. I want to thank you so much for joining us this morning and giving us some things to think about.
Perfect. Thanks, Corey.
For more pharmacy information, you can visit londondrugs.com. As a reminder, please talk to your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition.